Welcome back to the Dr. Jeffrey Tauth Heart Talk Show. I'm your host, Dr. Jeffrey Tauth, and today's show is called Dr. Jeffrey Tauth Heart Attack versus Sudden Cardiac Arrest, Understanding the Vital Difference. And trust me, it's juicier than your cousin's peach cobbler. You know what drives me absolutely crazy? Every year, thousands of people die because folks confuse heart attacks with sudden cardiac arrest. I'm talking about two completely different emergencies here, people. It's like confusing a fire with a flood. Both are disasters, but you sure don't fight them the same way. Today we're going to clear up this life or death confusion once and for all. Let me break this down for you in terms even your Uncle Bob would understand. A heart attack is like having a clogged drain in your kitchen sink. You've got a blocked artery, and your heart muscle is literally starving for oxygen. It's a plumbing problem, pure and simple. The heart's still beating, just not getting the supplies it needs. Sudden cardiac arrest? That's your electrical system going completely haywire. Think of it like someone yanking the power cord out of the wall. The heart doesn't just struggle, it stops beating entirely. Game over. No pulse, no nothing. One's a plumbing issue, the other's an electrical malfunction. See the difference? Here's what really gets me fired up. With a heart attack, that person is usually conscious and talking. They might be clutching their chest, sure, but they're awake. They're telling you it hurts, they're sweating, maybe feeling nauseous. They can literally describe what's happening to them. Sudden cardiac arrest victim. They collapse faster than a house of cards in a hurricane. No response, no breathing, no pulse. Zero warning time. We're talking seconds here, not minutes. One condition lets you walk and talk through it, the other drops you like a stone. Yep, entirely true, I can't make this stuff up. Let me tell you about something that happened just last month. A 45-year-old teacher felt some chest tightness during her lunch break. Smart woman thought it might be heartburn from that cafeteria meatloaf, but something didn't feel right. You know what she did? She drove herself to the emergency room. Turned out to be a heart attack, but she survived because she stayed conscious the entire time. Now, if that had been sudden cardiac arrest instead, she would have collapsed right there in the school parking lot. The difference between these two conditions literally determined whether she could save herself or not. That's how critical this distinction is, folks. So what do you actually do when faced with each situation? If someone's having a heart attack, call 911 immediately. Give them aspirin if it's available and they're not allergic. Keep them calm and comfortable. These folks need to get to a hospital fast, but they're still with you mentally. Sudden cardiac arrest. Different ballgame entirely. Call 911, but then you better start CPR right away and find an AED if there's one nearby. That person needs electricity to jumpstart their heart, not medication. Wrong response here wastes precious time that victim doesn't have. I see this confusion in my clinic all the time. People come in telling me about their neighbor who had a massive heart attack and collapsed unconscious. Maybe I should see you in the clinic. We need to talk. Because 9 times out of 10, what they're describing sounds more like sudden cardiac arrest. Look, I get it. Both conditions involve the heart, both are scary as heck, and both can be fatal. But treating them the same way is like using a hammer when you need a screwdriver. Sure, you might get lucky, but you're probably going to make things worse. Here's your takeaway, and I want you to remember this like your own phone number. If someone is conscious and talking, you're likely looking at a heart attack. Call 911 and keep them comfortable. If someone is unconscious and not breathing, that's cardiac arrest. Call 911 and start CPR immediately. The bottom line? Know the difference, and you just might save a life. Could be your spouse, your parent, or that guy at the grocery store. Either way, you'll be the hero who knew what to do when it mattered most. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.